exploring the factors behind the greater prevalence of autism in Western society. Introduction: Autism spectrum disorder is a complex neurodevelopmental condition characterized by a range of challenges in social interaction, communication, and behavior. Over the past few decades, there has been a significant increase in the reported prevalence of autism, particularly in Western societies. While the exact reasons for this rise are not fully understood, various factors contribute to the greater prevalence of autism in Western society. Diagnostic changes and awareness. One key factor contributing to the high reported prevalence of autism in Western society is improved awareness and diagnostic criteria. Over time, there has been a broadening of the diagnostic criteria for autism, allowing more individuals to be diagnosed accurately. This increased awareness and improved diagnostic practices have led to a higher rate of diagnosis, particularly among children and adults who may have been overlooked in the past. Increased screening and early intervention. Western countries have invested heavily in early screening and intervention programs for autism. The availability of these programs means that children are being identified and diagnosed at younger ages, allowing for early intervention and support. This proactive approach has led to higher autism prevalence rates as more cases are identified early in life. Genetic and environmental factors. Research suggests that both genetic and environmental factors play a role in the development of autism. Some studies have indicated that certain genetic mutations associated with autism may be more prevalent in Western populations. Additionally, environmental factors such as prenatal exposure to toxins have been explored as potential contributors. However, the interplay between genetics and the environment in autism is complex and not fully understood. Increased research and funding. Western societies tend to allocate significant resources to autism research and support services. This increased funding has led to greater awareness, more comprehensive studies, and a better understanding of autism. As a result, more cases are identified, contributing to the higher prevalence rates in these regions. Changes in diagnostic labeling. In some cases, children who may have been diagnosed with other developmental disorders or intellectual disabilities in the past are now being diagnosed with autism due to changes in diagnostic labeling. This shift in terminology can influence the reported prevalence rates of autism in Western society. Cultural and social factors. Cultural and societal factors also play a role in the reported prevalence of autism. Western societies often have more structured healthcare systems and educational services, making it easier for individuals with autism to access diagnosis and support. In contrast, in some non-Western societies, autism may be underdiagnosed or misunderstood. Autism acceptance and inclusivity. Western societies have made significant strides in promoting autism acceptance and inclusivity. As a result, individuals who may not have sought a diagnosis in the past are now more willing to do so, contributing to the increased prevalence rates. Conclusion: the greater prevalence of autism in Western society can be attributed to a combination of factors, including improved diagnostic practices, increased awareness, genetic and environmental influences, research funding, changes in diagnostic labeling, cultural differences, and societal attitudes. While these factors contribute to a high reported prevalence, it is important to recognize that autism is a global issue, and efforts should continue to focus on understanding and supporting individuals with autism, regardless of geographical location. Increasing awareness, early intervention, and inclusive policies remain crucial in ensuring that individuals with autism can lead fulfilling lives and reach their full potential.